Welcome to our Teaching Value in Healthcare Learning Network, where we get to hear from innovators from around the country and really from around the world share their innovations on how they are teaching healthcare value and integrating it into clinical practice. My name is Chris Moriates. I'm the Director of Implementation Initiatives for Cost of Care and also at Dell Medical School at UT Austin. And today I'm really lucky to be speaking to Dr. Steph Nothelle. She's the National Project Lead for Primary Care Progress on student hotspotting. She's also from Johns Hopkins, where she's a geriatrician, and she leads their own student group on hotspotting. So she's an advisor and a leader on both the local and national scale. So thank you for joining us, Steph.
Yeah, thanks so much for having me, and thanks for that great introduction.
Absolutely. So maybe you could tell us a little bit about student hotspotting and how it started and what currently is happening with this learning collaborative.
Yeah, absolutely. So student hotspotting started in about 2014. At that point, Jeff Brenner, who was leading the Camden Coalition, thought that the work that he was doing, which was targeting some of the highest utilizers in the healthcare system and bringing a team of all different healthcare professionals to try to overcome the barriers that those patients were facing that was causing high utilization, he thought to himself, you know, we really need to be teaching the next generation how to do this. Otherwise, this model is never going to spread and succeed. So he joined forces with Primary Care Progress, as well as the American Association of Medical Colleges to form a national learning collaborative called the Student Hotspotting Project. And when it started, it was just 10 schools from all across the nation. And to apply, a school just had to have at least 2 health professions represented in a training program or in a school. And what each school did was they would have a team of about 6 students. And those students would identify some of the highest cost or highest utilizers in their local area. And students did that in a wide variety of different ways. And then their job was to work together as a team to really get to know the patients that they identified and really try to understand from the patient's perspective what it's like navigating the healthcare system and the troubles that they were having that ultimately led in this cycle where they kept utilizing the emergency department or were being admitted to the hospital again and again. So students did that for 6 months in the first year, and it was a huge success. So they grew the program in 2015, and they grew it again in 2016, and it's still growing. There's over 30 different institutions represented, and there's more professions represented than I knew would be interested in this work, which is amazing. I mean, there's everything from medical students, nursing students, pharmacy students, who you might think of automatically, to family counseling students, nutritionists. We've had some chaplain students involved. It's been a really wonderful, diverse group. And the one newer thing that's starting this year is that the Camden Coalition is located in Camden, New Jersey, as its name would suggest. So they have actually spread out some of the ownership of this learning collaborative to 4 different regional hubs. So that way, the students who get together at the beginning and the end of the 6-month period don't have to travel quite as far. So for example, in Baltimore, we're only traveling up to Philly. Jefferson will be our hub.
Cool, and that's, I'd heard the 4 new hubs were launching in September, so that's what you're talking about is happening, yeah.
Yes, exactly, yeah. So the 4 hubs there's one on the East Coast, which is Jefferson. There's one in the Midwest, which is Southern Illinois University, and then 2 further west at University of Utah, and then at Samuel Merritt, which is in the Bay Area of California.
Great.
Yeah.
And you mentioned that the program was such a success from the start. When you say success, what do you mean? Like, what did that look like?
Yeah, so I mean, I think you can define success in a lot of different ways, and I think it was successful from the viewpoint of a number of different stakeholders. So, for example, within my own institution, it was incredibly successful to bring together different health profession students. And they actually remarked, kind of unsolicited, how great it was to get to know what the other health professions trainings programs were doing, and to actually work with another health professional trainee around the care of a patient, instead of sometimes their interprofessional education sessions were more lecture-based, or sitting in a classroom and discussing something that they felt like they learned much more working around the care of the patient. Certainly from a medical education point of view, I felt like they learned so much in 6 months that it took me forever to learn, and I'm still learning. Every time I do this, I learn something new, and it's wonderful. It's just incredibly high yield learning around health systems, around teaming, around communication. And then also from the health system perspective, I have to say these students are really amazing. They made way more of an impact on some of these patients than I feel like I do in primary care. I'm always striving to be at their level, but it's pretty amazing, some of the results that they're able to report.
Yeah, I mean, it seems in retrospect, it's such an obvious idea when you think about it. You've got these students who want so badly to make a difference and to have interactions with patients and to get involved. And then you've got this need. And so to get them organized around that, it's so obvious, and yet, it wasn't obvious for us for so long. And the idea that really bringing these interprofessions together around a goal and around a project, so they're working together. They're not coming to learn how to be teams in a classroom, but they're living it, and they're learning it experientially. It seems to me that really is the power behind what you guys have done.
Yeah, absolutely.
Yeah. And so tell me, do you have a story or something, maybe from those early years, or it could be more recent, but about how these students have worked with a patient or with the health system, and kind of the results that they've seen?
Sure, yeah. One of the most dramatic examples that I still remember from the first year, there was a team from the University of Rochester, and they identified the highest cost individual within the University of Rochester health system. So not just like, a high cost person, the highest cost person. And this relatively young woman had end-stage renal disease, and she also had some mental health problems, I believe a personality disorder. Mm-hmm. And so because of this, and I'm sure a number of other factors, she didn't always get along with her dialysis centers. And so she had been administratively discharged from every single dialysis center in the area. So all of her ED visits and admissions were because of lack of dialysis, which she depended on. So these students, they met with her, talked about her experience, kind of just gained her trust by showing interest in her as a person. And they were able to advocate for a local dialysis center to give her another chance. And what they did the first several weeks that she was going back to dialysis is they would go with her. And they would bring things that she liked to do during the HD session. So if she got agitated or anxious, she could have something to distract her. I remember they brought like coloring books and word searches and things just to kind of distract her. And so they saved millions of dollars, because once she was back into dialysis, into a regular HD center, she didn't have to go to the emergency department anymore. But until the students came along, there was no one there to advocate for her. So that was a really simple but powerful example of how just, getting to know a person, building rapport can make a huge difference.
Yeah, I think that makes a lot of sense. And programs or places that have not implemented this, I think I heard you mention that there's more than 30 institutions around the country already. What would they do, or how would they get involved if they say, let's say medical students who are listening to us say, gosh, I wish we had that at our school. or medical educators listening saying, I would love to get our students engaged in this? What should they do?
Yeah, absolutely. So there's a ton of information online if you just Google Camden Student Hotspotting Learning Collaborative. But basically, the process of getting involved, there is an annual application cycle. So it's usually in the, I want to say they announce it around January or February, and then the application's due around April. To qualify and to apply, you just have to have, they now raised the bar, you have to have 3 health professions represented. So you need to
At what level, Steph? At like at the student level and the faculty sponsorship level, or?
Right, yeah. So at the student level, and then there needs to be 1 faculty advisor from each of the disciplines represented.
Okay.
You also need to have a licensed clinical social worker on your advising team, because it turns out that they are like an amazing, valuable resource, as if we didn't already know that. It really sends that home. And then you just have to commit to doing the work. So the work of identifying patients, and then participating in a curriculum over 6 months that involves 2 in-person meetings, 1 at the very beginning and 1 at the end. And then in between, everything's online. So there are some interactive webinars just like this, where the students get to present the patients they're working with, and then a preceptor gives them some tips and guides them through the issues that they're having. And then there's a lot of skills-based webinars as well. So you just fill out the application. You do have to have institutional support. So someone from the Office of Student Affairs needs to say that they're okay with you taking this on. And there is, in the last couple of years, Camden has been doing this kind of out of the goodness of their heart. So they have started to ask for some monetary support to participate. And that value, I think, is in flux, so I can't say for sure what it'll be next year, but that is another component.
Sure. And I know there's some confusion, because I know I was confused. Can you explain how this ties in with Primary Care Progress, something that Primary Care Progress chapters do? Is it part of every Primary Care Progress chapter, or does every hotspotting institution also have a PCP chapter? Maybe just explain how those are the same but different.
Yeah, absolutely. So Primary Care Progress is one of the sponsors. Although when I mentioned at the beginning, it was the AAMC, Camden, and PCP, it's now grown to more health professional societies than I could list for you are in support. But the PCP component, so Primary Care Progress is a national nonprofit that tries to really engage students and trainees around a model of leadership called relational leadership, which is really focused on getting to know individuals to help make change. So Primary Care Progress teaches some of those core skills during the student hotspotting curriculum. So, for example, there are sessions on using your own story, how to use story to advocate for change. There are sessions on kind of understanding your strengths or identifying the strengths in the patient you're working with, and the value of taking a strengths-based approach, whereas in healthcare, we traditionally take a problem-based approach. So they just help build the curriculum and kind of round it out so it's not just focused on the maybe traditional healthcare stuff of systems and medications, but also that interpersonal relationship aspect that's so important.
Sure. Yeah, that's great. We're actually looking forward to starting our own Primary Care Progress chapter here at Del Med this October when Andrew Moore Singer's out here for ACL for some music and barbecue. We're going to steal him and start our Primary Care Progress chapter. And I know the students have been really excited about this idea of hotspotting, and so we'll have to figure out how we can integrate that as well. So tell me about, these are obviously lots of success, lots of great stories. There's so many potential benefits of a program like this, but it can't all be easy. What are the barriers?
Right.
What are the issues that you've come across in these last few years?
Yeah, that's a great question. And certainly every institution faces its own set of issues. The first being getting institutional support. This is something really novel, right? Like we're using students to work with patients, but they're not providing medical care, but they are accessing the medical records. It's kind of a weird, uncharted territory. And so some institutions, I totally understand why, are a little bit nervous about that and what it means in terms of, patient privacy and all sorts of things. So a lot of institutions, when they first get started, have had to have a number of conversations about what the project is and what the project isn't. And most institutions have found that if you can talk to a quality improvement officer, this falls really nicely under that domain. It's not really research. You're not collecting patient data to do research. You're trying to improve the quality of care.
Right.
The other barrier is now that Camden has very understandably asked for some financial support. It's not always easy to find that for medical education projects. Some institutions have some funds for interprofessional education, and they've used those. We've been really lucky at Johns Hopkins. We've partnered with our medical assistance provider, and so we only target their patients. And in exchange for doing that, they help fund our participation in the National Learning Collaborative. And then certainly there's always this issue of time, right, that comes along with any project. Some institutions have supported faculty time, some haven't. So that's another thing to kind of sort out.
Yeah. Well, thank you so much for explaining student hotspotting, and how it's grown over the last few years, and how it's really been an amazing way to bring multidisciplinary students together and activate them to learn and do experiential projects that have the benefit of actually improving care for specific patients. It sounds like a win all around, and I think an amazing model as people start to think about how do we get students to play more of a value-added role, and then similarly, how do we provide the best care possible to these patients who need it the most, and so pairing those two up makes a ton of sense. So I really appreciate it. I suspect that a lot of people that have been listening will be very interested in this model. And I personally enjoy getting the opportunity to meet you, and hopefully maybe I'll see you out there in October. I know many of the folks as part of our learning network will be out there for the High Value Practice Academic Alliance Summit.
Oh, great, yeah.
BPAA, so we'll be out there in October, out there in Baltimore. Thank you, Steph. I appreciate it.
Yeah, thank you so much. I love any opportunity to talk about this project because I think it's fabulous, and I hope that people are inspired to join because you can really make a huge difference.
Yeah, I agree. So thank you to all those that have been listening or watching. Please remember to join us every third Thursday for our Teaching Value in Healthcare Learning Network webinar. See you next month.